Now to a health warning affecting the entire country. Medical experts are sounding the alarm about a possible triple-demic that could unfold this winter. Yep, a triple-demic. That means cases of COVID, flu, and RSV, a virus that's been impacting children, are all expected to rise. We spoke earlier with White House COVID response coordinator. That's Dr. Ashish Jha. This phrase, triple-demic, please explain.
Good morning, Gayle. Thanks for having me back. It's always concerning when you have three respiratory viruses, RSV, influenza, and COVID, rising at the same time. Obviously, that's something we're going to monitor very closely. But the good news here, Gayle, is that we're not powerless against this, right? We have flu shots that keep people out of the hospital. We have COVID shots. We have a brand new COVID shot that is formulated against the virus that's out there right now. That will keep people out of the hospital, prevent people from getting seriously ill. So if people went out and got their vaccines, we could really get through this without getting into a lot of trouble.
I hope so. I just went and got my brand new COVID shot. I feel really good about this. But what are you most concerned about right now? You're dealing with three issues. What are you most concerned about right now?
Well, obviously, the thing that we always are paying attention to is making sure there's plenty of hospital capacity and that healthcare capacity doesn't start getting stretched. And with all three of them, if all three of them rise at the same time, again, if people are not vaccinated, then we can start seeing a lot more hospitalizations. Hospital capacity is very important. We need hospitals for all sorts of things, not just those viruses. So right now, our focus is get people vaccinated, get people treated, and keep people out of the hospital.
I have a lot of friends, very educated, smart people who say, look, I've got vaccine fatigue. I'm not getting another shot. What do you say to those people? You worried about vaccine fatigue? Yeah.
Yeah, what I say is, look, for every year for the last 20 years, I've gone out and gotten a flu shot every fall. It's just part of being healthy in the fall and winter. That's where we are with COVID as well. So for most Americans, it's now a once-a-year shot. Go out and get your fall COVID shot. It's updated. It's targeting the virus that's out there. It really will make an enormous difference. And then you're good to go. For most people, you're good to go for a year and don't have to think about vaccines again for a while.
There's no vaccine for the RSV for little children. What should parents do? What should they do? What should they know about this?
Yeah, not yet. I know there are a couple of companies working on it, and my hope is within a year we will have it. Again, for most people who get RSV, it's pretty mild. Young kids, as you said, can get into trouble with breathing issues. What I'd say is there are lots of standard ways of avoiding it, right? Like avoid sick contacts. If you have a sick kid, keep them at home. Wash your hands. Those are things that really make a difference in keeping RSV levels low. And obviously, if you have a child who gets sick and if they start having any kind of difficulties with breathing, then obviously you got to go get them seen by a pediatrician, got to get them seen by a doctor.
Right now, the government, for the most part, pays for the COVID vaccine. When do you expect that to stop? Pfizer just announced they're going to start charging $130 per shot after the contract runs out. When do you think the government is going to stop paying for the COVID shots?
Yeah, it's a great question. I mean, right now we have plenty of vaccines that we have bought for Americans. And so this fall, winter, into early part of 23, I think people should know that COVID vaccines will remain free for all Americans. At some point in 2023, especially given that Congress has stopped funding this altogether, sometime in 2023, I do expect that transition to happen. But we just don't have a date right now when exactly that'll happen.
All right. Well, we'll count on you to keep us updated. Dr. Ashish Jha, always good to see you. Thanks for your time.
Thank you.